Your doctor looked at your blood pressure reading last week, smiled, and said you're doing great. 120 over 78, perfect numbers. And you walked out of that office feeling good, feeling like you were winning. But since starting that second blood pressure medication 6 months ago, something has been quietly wrong. You stand up from your chair and the room tilts. You get out of bed at night and have to grab the wall. You feel foggy in the afternoons in a way you never did before. Your doctor says it's probably just age. I'm here to tell you it might not be age at all. It might be your medication working exactly as it was designed to work, and that's the problem. My name is Dr. Joseph Lee, and what I'm about to share with you today goes against what most doctors are still telling their patients. It's not because they're bad doctors. It's because the research is newer than the guidelines they're following. And that gap between what the science now shows and what's happening in exam rooms across the country is quietly putting people like you in serious danger. By the time this video is over, you're going to understand why the standard blood pressure target was never designed for someone over 70. You're going to learn the exact range that research now associates with the longest, healthiest lives in older adults. And I'm going to show you a simple 3-minute test you can do in your own bedroom tonight that could tell you whether your current treatment is actually putting you at risk for a fall. All the references for what I share today are in the description below. I'm not asking you to take my word for anything. I'm asking you to read the science yourself. And before we go any further, I want to ask you something. What country are you watching this from? Drop it in the comments right now. And tell me this, have you or someone you love ever felt dizzy, lightheaded, or unsteady after starting a blood pressure medication? Because if the answer is yes, this video was made for you. Share your experience below. I read every single comment and I respond to as many as I can. The setup, why this matters. Let me paint you a picture that's more common than most people realize. A 74-year-old woman walks into her doctor's office for a routine checkup. She feels fine. She's been walking 2 miles every morning, cooking her own meals, staying active. Her blood pressure reads 144 over 82. The doctor opens the guidelines on the computer screen, sees the recommended target of below 130, and starts her on a new medication. 3 months later, her pressure is down to 122 over 76. The doctor calls it a success. But now she's not sleeping through the night anymore because every time she gets up to use the bathroom, she feels like the floor is moving under her feet. She stopped her morning walks because she feels unsteady. She mentioned the dizziness at her last appointment, and her doctor told her to just stand up more slowly. 6 weeks after that, she slipped getting out of bed. She fractured her hip. That fracture led to surgery. Surgery led to a hospital stay. The hospital stay led to complications. And this woman who had been walking 2 miles a day just 4 months earlier was now in a rehabilitation facility wondering what happened to her life. I want you to understand something. That fractured hip wasn't an accident. It was a predictable consequence of applying a blood pressure target designed for middle-aged adults to a 74-year-old woman whose body operates by completely different rules. And this happens thousands of times every single week across the world. What the research actually says. Here's what most doctors haven't had the chance to read yet. A study published in JAMA Internal Medicine followed more than 15,000 adults over the age of 75 for 5 years. Real-world patients. People with diabetes, heart disease, kidney disease. Not cherry-picked healthy volunteers. Real older adults living real lives. The researchers divided participants into groups based on their average systolic blood pressure, that's the top number, and tracked what happened to each group over those 5 years. What they found turned the conventional wisdom completely upside down. The group with the lowest death rates, the fewest hospitalizations, the best overall outcomes, was not the group with pressure below 120. It was the group sitting between 130 and 145. The group that achieved that textbook perfect number below 120 had a 28% higher rate of serious falls requiring hospitalization. their kidneys were under more stress, and their overall mortality was actually higher than the group running moderately above the standard target. 28% more falls. Let that number sit with you for a moment. Your doctor celebrated getting you to 120. The research says that number might be costing you your safety. The biology. Why your body is different after 70. Now, I want to explain why this happens, because once you understand the biology, the numbers make complete sense. Your cardiovascular system at 72 is not just an older version of your cardiovascular system at 45. It is genuinely changed in ways that make the same blood pressure number mean something completely different. Change number 1, your arteries have stiffened. When you're young, your arteries are like fresh rubber tubing. They're flexible. When your heart pumps blood through them, they expand slightly to absorb the pressure, then recoil to help push the blood forward. That flexibility acts as a natural buffer. After decades of use, those arteries become less elastic, more like old garden hose left out in the sun, stiffer, less giving. When blood moves through stiff arteries, there's no buffer. The pressure hits hard. And here's what matters for your treatment. Your body needs slightly higher baseline pressure to push blood through those stiffer vessels all the way up to your brain, especially when you're standing upright and fighting gravity. When medication artificially pushes pressure too low, the blood simply doesn't reach where it needs to go as reliably. Change number 2, your pressure sensors have slowed down. Your body has tiny sensors in your blood vessels called baroreceptors. Their job is to detect pressure changes and immediately signal your brain to compensate. When you stand up, pressure drops momentarily and your baroreceptors instantly trigger responses. Faster heart rate, constricted vessels, to bring it back up within seconds. In a young, healthy body, this happens so fast you never notice it. But after 70, these sensors become sluggish. The response is slower. The compensation is less precise. So when you stand up and your pressure drops, your body takes longer to catch up. If your baseline pressure is already sitting low because of medication, that delay can take your blood pressure to a level where your brain genuinely isn't getting enough blood flow. That's the moment the room spins. That's the moment you reach for the wall. That's the moment a fall happens. Change number 3, your medications last longer. This one surprises people. Your liver and kidneys are responsible for clearing medications from your system. At 75, both of these organs work more slowly than they did at 50. A dose of blood pressure medication that clears out of a younger person's system in 12 hours might still be circulating in your body 18 or 20 hours later. This means the medication has more time to work, more time to push pressure down. And if your target is already set aggressively low, that extended effect compounds into territory your body wasn't designed to handle. Same pill, same dose. Very different impact depending on your age. The test. What you can do tonight. Here's something I want you to actually do. Not someday, tonight. It's called orthostatic blood pressure testing, and it takes about 3 minutes. All you need is a home blood pressure monitor. You can find one at any pharmacy for around $30. Here is exactly what to do. Lie flat on your bed and rest for 5 full minutes. Don't rush this part. Let your body settle. After 5 minutes, take your blood pressure while still lying down. Write down both numbers. Now stand up. Take your blood pressure immediately while standing. Don't wait. Do it right away. Write those numbers down too. Now compare them. If you're systolic, the top number, drop by more than 20 points between lying and standing, or if you're diastolic, the bottom number, drop more than 10 points, you have what's called orthostatic hypotension. This is a red flag. This tells you that your blood pressure is dropping significantly every single time you go from lying or sitting to standing, which means every time you get out of bed, every time you stand up from the dinner table, every time you go to the bathroom at night. You might be taking that drop without even realizing it, just writing off the brief dizziness as tiredness or age. It's not age. It's your blood pressure medication doing exactly what it was designed to do. and doing it at the worst possible moment. Write these numbers down and bring them to your next doctor's appointment. Say these words: I tested my orthostatic blood pressure and I found a significant drop when I stand. Can we talk about whether my current target is appropriate for my age? That conversation could be one of the most important ones you have this year. The real targets, what the evidence supports. Let me give you the ranges that current evidence supports for different age groups. And I want to be clear, these are guidelines for an informed conversation with your doctor, not a reason to adjust your medication on your own. Never do that without medical guidance. For adults between 65 and 74 who are generally healthy and active, research supports a systolic target somewhere between 130 and 140. This provides real cardiovascular protection while keeping pressure high enough for safe blood flow to your brain and organs. For adults between 75 and 84, the evidence leans toward 135 to 145. Notice that this is higher than the younger group. That's intentional. It accounts for the arterial stiffness, the slower baroreceptor response, and the increased medication sensitivity we talked about. For adults over 85, or for those who are frail at any age, a systolic somewhere between 140 and 150 may genuinely be the safest range. At this stage, preventing falls and protecting cognitive function often matters more than chasing a number that was derived from studies on much younger populations. Now here's what almost no one talks about, the diastolic number. That bottom number matters too. For older adults, diastolic pressure should generally stay above 65. Your heart refills with blood during the relaxation phase between beats, and it relies on adequate diastolic pressure to do that properly. If your diastolic is consistently below 60, even if your systolic looks fine on paper, that's worth raising with your doctor. Two different people, same number. I want to show you something that really illustrates why treating the number instead of the person is so dangerous. Picture two people. Both are 79 years old. Both walk into their doctor's office with a blood pressure reading of 152 over 86. The first person has mild heart failure, stage 3 chronic kidney disease, and takes 4 medications daily. They've had one fall in the past year. They use a cane. The second person plays tennis twice a week, no significant medical history, takes no regular medications, goes on weekend hikes with their grandchildren. Same age, same blood pressure reading. But the treatment approach for these two people should be completely different. For the first person, aggressively pushing blood pressure below 130 carries serious risks. More medication means more orthostatic drops. More drops means more falls. For someone already using a cane with kidney disease, a fall could be catastrophic. A more cautious target, perhaps 140 to 145, combined with close monitoring, makes far more sense. For the second person, some treatment might be reasonable. But even here, the target probably isn't 120. It might be 135. And it should be reached gradually, with each step monitored carefully for symptoms. Same number walking in, completely different conversations walking out. This is what good medicine looks like after 70. Not applying the same rule book to every body. Treating the person sitting in the chair. Why your doctor might not know this yet. I want to address something honestly because I think it matters. Your doctor is not trying to harm you. I genuinely believe that. Most doctors are working hard, seeing many patients, and doing their best with the information they have. But here's the reality of how medicine works. Clinical guidelines are created based on large studies, and then those guidelines take years to reach everyday practice. The major blood pressure trials that established the aggressive targets most doctors still follow today were conducted primarily in middle-aged adults. When the results came out, guidelines were applied broadly, across all ages, with the assumption that what works at 50 works at 80. It doesn't. Researchers have only recently begun specifically studying older populations and finding that the relationship between blood pressure and outcomes changes significantly after 75. That research is real. It's published. but it hasn't fully filtered into the guidelines your doctor learned in training or is following today. This is not a conspiracy. This is just the natural lag between science and practice, which means you have a role to play. An informed patient who brings specific questions to their appointment gets different care than one who passively accepts whatever the screen says. Not because doctors respond to pressure, but because context changes decisions. What to do? Your practical steps. Here's what I want you to actually do with everything you've just learned. Step 1. If you don't have a home blood pressure monitor, get one this week. Check your pressure at the same time each morning and evening for 2 weeks. Log every reading. This gives you a true average, not the artificial number you get from one anxious reading in a doctor's office. Step 2. Do the orthostatic test tonight. Lying down for 5 minutes, take your pressure, then stand up immediately and take it again. Compare the numbers. Write them down. Step 3. Write down every symptom you've noticed since starting or increasing blood pressure medication. Dizziness when standing, afternoon fatigue, brain fog, unsteadiness on your feet. These aren't coincidences, and they're not just age, they're data. Step 4. Schedule a dedicated appointment with your doctor specifically to discuss your blood pressure target. Not a rushed conversation tacked on to the end of something else. A real conversation. Bring your home readings. Bring your orthostatic test results. Bring your symptom list. And ask this question directly. Given my age and what I've been experiencing, is my current blood pressure target appropriate? Or should we consider a slightly higher range that might reduce my fall risk? Your doctor may not have seen the recent research. That's okay. You can bring it to them. The studies are in the description below. A good doctor will engage with that conversation. They will respect you for it. Step 5. If you feel rushed or dismissed, ask again. Your quality of life matters. The ability to stand up without the room spinning matters. The ability to walk to your mailbox without holding on to something matters. These things deserve to be part of your treatment conversation, not afterthoughts. Conclusion. Your blood pressure number is not the goal. Your life is the goal. The ability to stand up confidently, to sleep through the night, to walk into a room without calculating where the nearest wall is, to live in your body without fear. A number on a monitor that looks perfect while your brain is quietly being starved of blood flow every time you stand up is not a success. It's a warning sign wearing a costume. You now know something that genuinely changes the conversation. You know that the target was never designed with your 75-year-old body in mind. You know what the recent research actually says. You know how to test your own blood pressure response at home. And you know how to have a better conversation with the doctor who is trying to help you. That knowledge is yours now. Use it. And please, share this video with someone you love who is over 70 and on blood pressure medication. You may not know it right now, but that share might be what keeps them on their feet. Drop a comment below and tell me, did anything in this video explain something that's been happening to you? Have you felt dizzy after starting blood pressure medication? Have you mentioned it to your doctor? I read every comment. I will respond. Your experience matters. If this video gave you something useful, subscribe to this channel. Every week I come here to give you honest, research-based information about what's actually happening in your body after 60, not what sounds good in a 30-second appointment. Take good care of yourselves. I'm Dr. Joseph Lee, and I'll see you in the next one.